So moving on now to explore the concept of health research more broadly, I want to share my own perspectives on this. And again, I want to encourage you as well, please, to submit questions and comments using the Q&A box, and I look forward to discussing them with the panel a little later. But if you mention health research generally to people, people's first thought is often about curing disease or illness, and that is entirely natural. We tend to think about what we know and also what impacts us directly. And after all, if we think about the big killers in Ireland, half of all the deaths here are caused by cancer, heart disease, or stroke. And there's hardly a family in Ireland unaffected by those. As a direct result of research, there's been a dramatic increase in survival rates for these illnesses. So take cancer. Survival as well as treatment are now much better. Ireland was at the forefront of a breast cancer trial supported by the HRB, which looked at chemotherapy in early stage breast cancer. The trial was able to identify the women chemotherapy worked for and the ones it didn't. And what that meant was that lots of people now avoid unnecessary and distressing chemotherapy treatment. Or if you look at the other big killer, heart disease, we now understand much better what to do to prevent it. Thanks to decades of research, we know the importance of diet and of reducing smoking. And as a result, rates of heart disease and deaths from heart disease have fallen significantly. So research does a lot in terms of preventing disease, improving treatments, and changing approaches to care, all of which have great benefits. Look at some of the outstanding public health achievements of the 20th century on foot of research. First up, vaccination, a preventative treatment and very topical. We've seen firsthand in the past year with the COVID vaccine, the difference that made to our lives. And indeed, last week, you may have read the reports that the HPV vaccine has helped reduce the incidence of cervical cancer by 90%. Control of infectious diseases has also been key. Another interesting one in the context of COVID, if you look at how many lives have been saved globally by controlling the spread of malaria, HIV, or typhoid. Antibiotics, of course, hailed a new era in terms of how we treat communicable diseases, or more recently, take the smoking ban, which is both a political and a public health intervention. Research shows that the ban has given non-smoking bar workers who are now exposed to less second-hand smoke healthier hearts and lungs. In the year after smoking was banned, there was a 12% drop in the number of patients admitted to hospital with acute coronary syndromes. And the ban is also linked to a decline in admissions with acute pulmonary disease for certain age groups and an overall reduction in admissions for asthma. So all of these changes came about through investment in research, through people doing what we're talking about today, asking an important question, doing the research, gathering the evidence, and applying that evidence to make changes to lifestyle, diagnosis, treatments, regulation, and public policy. And the good news is that as a result, we're living longer. Life expectancy in Ireland has increased by more than 5 years in the past 2 decades, and a child born today could expect to live to be 100 years old. Of course, that brings its own challenges. But today, I'd like you to think about health research in all its diversity. So not just in terms of preventing illness or curing disease, but in the broadest sense in terms of what it means to be healthy. So let's look back at the last year or so. Of course, we wanted to avoid getting COVID-19, but it turns out that being healthy isn't just about avoiding illness. It's also about good social interactions, feeling connected. Something catapulted into the mix was loneliness, and loneliness also makes people sick. Research tells us that being chronically lonely is as bad for your health as smoking 15 cigarettes a day, and sadly, COVID delivered loneliness to many of us in spades. Doctors have known for some time that loneliness is bad for the mind. It leads to mental health problems like depression, stress, anxiety, and lack of confidence. But there's also growing evidence that social isolation is connected with an increased risk of physical illness as well. But loneliness isn't just a sole preserve of COVID, so how do we tackle it? Consider also the impact of poverty and inequality on people's health. A recent WHO report found that health is influenced by factors like poverty, food security, social exclusion and discrimination, poor housing, unhealthy early childhood conditions, poor educational status, and low occupational status. And soon, unfortunately, we'll probably add the effects of climate change to that list. Here in Ireland, there's a 5-year difference in life expectancy between people living in the most deprived areas and the most affluent areas. So looking at research questions, what's behind these differences and what can be done to change it? When asking research questions, we need to think about integrating people's social context into their healthcare, because health isn't just about making the right personal decisions or getting the right treatment. Access to housing, clean air, good public and social infrastructure, all of these make a huge difference to our health. And much of that comes down to public policy choices and decisions, how we organise society. It all has a huge impact on health. And the case study we're going to hear about shortly will also touch on this. We also have to remember that the world is also changing rapidly. Advances in technology, of course, can have positive impacts. If we look at how mobile phones and all that related technology increased our capacity to connect in recent times. But what about the next 40 years? So if we were here in years to come, in 40 years' time, what would we say had the biggest impact on health? No one can see into the future, but we do know that technological developments are going to have a big impact on health and healthcare. So how can we harness all the rapid changes in technology in productive ways to improve health and enhance care? For example, artificial intelligence is going to transform the delivery of healthcare and how clinical decisions are made, but we also need to think about its application. It's great to have data-driven decisions, but to what extent, for example, do we want decisions about our care being made by computers or algorithms that may have a built-in bias? And what sort of safeguards would we want to put in place? There's huge scope for using artificial intelligence in the area of medical imaging and radiology. For example, if you analyze brain MRIs using machine learning, it may be able to identify tissue changes that suggest stroke, which much greater sensitivity, say, than a person would do reviewing the same scan. And as well as faster and more accurate diagnosis, using artificial intelligence could help to make up for skill shortages around the world or in areas where resources are scarce. And there are other applications as well in areas like neurology. If it's possible in the future to have direct interfaces between technology and the human mind, people who have suffered diseases or injuries that have caused paralysis or have affected speech could be helped to recover movement or communication by brain-computer interfaces and artificial intelligence. Robotics are already used in healthcare, for example, in prosthetics, and increasingly used in surgery. But we may also see robots used in social care, for example, care of the elderly, which in a rapidly aging world is going to be more and more of an issue. But then there are important ethical questions to consider as well. Who benefits from this? Is a robo-carer what you want for your grandparents? And indeed, is it what you'd want for yourself? The benefits of personalized or precision medicine, I think, are easy to see. We know that a treatment for a certain disease may work very well for one person, but not for someone else. Immunotherapy, for example, has been used more to treat cancers. That's all about using your own immune system to attack tumor cells. But it doesn't work for everyone, and we still aren't sure who will benefit and who won't. Personalized medicine uses genomics to diagnose and treat disease in a way that's personal to that individual. It's complex, but personalized medicine approaches combined with artificial intelligence hold out the hope of much better and much more targeted treatments. Related to that, we're likely to personalize nutrition or diets. Research tells us that people process food differently and that some people respond to a dietary intervention while others don't. So understanding the reason why is the subject of a whole new area of research. And once we have the answers to that question, the next step is to be able to provide a personal dietary plan for people, maybe to address specific health issues based on a blood sample. Underpinning lots of these advances is data. Vast amounts of data and lifestyle data are being generated and collected all the time. For example, hospital records, medical records, genomic data, data from personal or wearable devices like your Fitbit or your watch, and of course, increased computational power. In other words, the power to analyze all that data quickly. And everyone can see the benefits of data. What's more complicated is how to manage and use the data effectively and safely, how to share data, and how to link it. So in other words, balancing out the benefits of the data with individual rights and privacy. When you consider the achievements that health research has brought and the opportunity it offers, we should be optimistic. And research is, at its heart, an optimistic pursuit because it's all about finding answers to difficult problems. Look at what humanity achieved with COVID in a very short space of time and the role played by research and evidence. We had our understanding of the science of COVID and its transmission, the development of treatments, the development of the vaccines, and it's also told us a lot about what it means to be healthy in the broadest sense, the value of our connections, the importance of mental health, the importance of society. So to get back to our topic today, what is important to you about health and healthcare? And where would you like researchers to put their efforts and governments to put their resources? If you try to think of research of scientific questions, it can sound quite technical and off-putting, but it needn't be. Because when it comes to health research, just think about what matters to you and to the people you care about. And don't just think about what you know today. Think big and think about what could be possible.